BruxZir is a 100% zirconia crown. So unlike most zirconia-based crowns where the zirconia makes up the substructure, the coping, and then we put porcelain on the outside of it, BruxZir is 100% zirconia from all the way to where it touches the prep all the way out to the occlusal surface. Now, why would we do this? Why would we go with this monolithic concept of a total zirconia crown? Well, one of the big reasons is when you take porcelain and you put it on something, whether it be a metal substructure or a zirconia substructure, when you put those two layers together, there's always the possibility that those two layers are going to come apart. The best case scenario for that is just some chipping on the porcelain that you might be able to polish unless it's an anterior tooth, or the porcelain can break off all the way, exposing the zirconia substructure or the metal substructure. So one of the big benefits of having a monolithic restoration is the fact that nothing can chip off of it because it's all made out of one homogeneous material and we don't have two materials that are fused together. Another reason why a BruxZir monolithic zirconia crown is such a good idea is because we see a lot of cases here in the laboratory where dentists have had to underprepare or underprepared for any number of reasons. And in those cases, we have very few choices. In fact, the choices typically come down to you can do a cast gold crown there, you can do a PFM crown with a metal occlusal there, or you can adjust the opposing until this PFM fits between it. Now, all three of those options aren't necessarily attractive to the patient. Patients don't really enjoy having their opposing teeth ground down to make room for the new crown. And more patients are objecting to cast gold crowns, which I don't happen to agree with, but this is the patient's choice, not mine. And patients aren't real big on a PFM crown that's got a big metal occlusal as well. So with a BruxZir homogeneous 100% zirconia-based restoration, now we have the ability to have something that we can use in those areas of limited interocclusal reduction that is still tooth-colored. Let's take a closer look at those three options I just talked about and talk about what the patient might like better. One option for a crown prep where we have limited interocclusal space is to use a metal occlusal PFM as you see here. And it's an okay solution. You know, there's really nothing wrong with it from a functional standpoint, but patients aren't real thrilled when they see it. In fact, I remember early in my career having a woman question, you know, the $750 she'd spent on a porcelain crown and why was it half metal, you know, on half the top and half the inside, and she could see it with a mirror on the lingual. So that's a solution, but it's not necessarily one where the patient's going to go, oh, great idea, doc, I'm glad it looks like that. Another solution is certainly to go with a cast gold crown, and there's really nothing bad that you can say about a cast gold crown. Gold is the longest lasting restoration that I've ever seen in the mouth. It won't break, it wears, it doesn't wear the opposing teeth. Everything that you can say about it is really nice, except for the fact that depending on where it is in the mouth, it can be seen from about 30 feet away. And there are just patients who simply refuse to have cast gold in their mouth. There are patients who still like cast gold, and most of them are dentists or work for dentists, but a lot of patients that I talk to simply don't want to have cast gold in their mouth. Therefore, we've got a situation where because we had a short clinical crown, maybe on a lower second molar or something like that, we have a very short prep, we couldn't reduce anymore, we've got some limited interocclusal space, and we need to place a crown back there. So these two choices aren't seen as aesthetically favorable for the patient. Well, enter BruxZir. Let's take a look at how BruxZir fits into all of this. And again, this is a 100% zirconia-based crown. So there's no porcelain on this crown. It's entirely zirconia. So the same type of zirconia substructure that you'd find on a lava crown or a Procera zirconia crown or a CZ clinical zirconia crown, this substructure now makes up the entire crown from the inside all the way to the outside. So there's no porcelain to break off of here, as long as we don't go any thinner than half a millimeter. But really no material does well at under half a millimeter. I mean, you can make cast gold that thin, but you're going to end up chewing a hole through it. This crown is virtually unbreakable, and that's how we talk about BruxZir, because it doesn't have any porcelain that can chip off of there. And by the same token, it's a very robust material, as you'll see when you try to take off your first zirconia-based restoration. It's very difficult to cut through, and you'll see that this is a strong crown. Now, if you look at this, it doesn't necessarily look exactly like a tooth, and I'll show you some pictures in just a second of some BruxZir crowns in the mouth, but that's not the point. This crown was not designed to be an aesthetic crown. It was designed to be more aesthetic than cast gold and more aesthetic than a metal occlusal. And if you had a study model with these three crowns on it, and told your patient they could have their choice of the three of these, what do you think are the chances that they're going to take this crown, even if it doesn't match maybe the first molar in front of it perfectly? This one might match a little bit better in terms of the porcelain, but half of it's metal, and the cast gold won't match at all. And so it's one of the big deals. Really, BruxZir, its primary indication in my mind is when you want to place cast gold in a patient's mouth and the patient simply won't accept it. BruxZir is a fantastic restoration in cases like that. Let's go ahead and take a closer look at how BruxZir looks in the mouth.
On this first case, we've got a great indication for a BruxZir crown. In fact, it was some of these early cases that actually helped us come up with the name. BruxZir, you can see this patient has broken the PFM that was in place in several places. I mean, there's hardly any porcelain left on that crown. You'll notice the dentist placed cast gold on the one behind it because they were afraid of that same breakage taking place with a PFM on the second molar, but the patient wanted to go with a PFM on the first molar and not have gold. So when he broke this one, it was the same kind of conversation that I would usually have about gold being the best, but today we had another option. And as you can see here, here's the BruxZir crown in place next to the cast gold. Now it's kind of bright. This is one of the earlier BruxZir cases, and we've gotten better at shading these over time. But you can see that it stands out a little bit, but doesn't stand out any more than the cast gold crown does. And furthermore, that's the hardest view to really get good, is how these teeth look from the occlusal. And really what you see more than that, if you're going to see anything, now granted this is a lower molar, so you're not going to see much of it, but when you view it from the buccal view is probably what somebody would see when the patient maybe happened to smile really big. And you can see in this case that the BruxZir crown blends in reasonably well with the adjacent teeth. You can see the gold crown behind it stands out a lot more, and even the PFM across from it does not blend perfectly with the adjacent teeth. So it's a very acceptable crown, at least in the mind of the patient. It's certainly preferable to having a cast gold crown on that same tooth. This second case is the same type of story. This is the patient who had an existing PFM crown. This one actually had some recurrent decay around the margin on the lingual, and you can see some porcelain had chipped off the mesial marginal ridge. So anytime I see broken porcelain now, the first thing I'm thinking of is BruxZir. And you can tell it's a really bright PFM. Part of that's the flash. But if we look at the buccal view of this crown, you can see the tooth over here. You can see a metal margin. That's obviously something you don't have to worry about with the BruxZir, and it blends reasonably well with the adjacent teeth. There's a PFM across from it too that blends reasonably well with the teeth across from it as well. But we actually made 3 crowns for this patient to give the patient a choice as to which one they like better. And so you can see the first one that we have in here is the crown with the metal occlusal. So we tried that into the patient's mouth. All 3 of the crowns fit exactly the same. We took a photograph and showed it to the patient. And you can see that doesn't really blend in. I guess the metal occlusal blends in a little bit with the amalgam behind it, but you know, at least from with the patient yawning or something, it doesn't look to blend in. The second choice is the cast gold crown that we have here. And again, cast gold is still my favorite material in dentistry. Unfortunately, patients just don't rank it that high. And the third view that we have is the BruxZir crown in place. And again, it's a little bit lighter than the adjacent teeth and doesn't quite blend in with the natural dentition. But as you can see on this split screen showing all 3 of them, it certainly blends in more than either of the 2 other choices. And when we show it from the buccal view, you can see that this crown blends in reasonably well with those. In fact, the PFM that we saw before that doesn't blend in all that well, that opposes it, I would say the BruxZir crown actually blends in a little bit better. And as the shades have gotten better on the BruxZir crown, we have seen them disappear more into the natural dentition. And a BruxZir crown at this dimension, I have complete faith that this crown will not fracture and will last as long as the same cast gold crown would last.
So in this brief introduction to BruxZir restorations, I've mentioned my 2 favorite indications. The first one is when we have limited inner occlusal space on a preparation where we should use cast gold or a metal occlusal, but the patient doesn't like the look of cast gold or metal occlusal. This is a perfect place to put a BruxZir restoration in place. The second place is anytime I see a broken PFM or any kind of broken porcelain. When I see a patient who's got a strong enough bite to do that kind of damage, I want to go with a virtually unbreakable material like BruxZir. BruxZir can also be used for inlays and onlays, so it really can be a cast gold replacement if you want it to be, if your patients don't like cast gold. I happen to like cast gold inlays and onlays better than composite or porcelain, so when patients won't accept those, that's when I move to BruxZir restorations.